My name is Dr. Joyce Sitonik. I'm Head of Clinic Business Operations at AAR Healthcare. AAR Healthcare is a network of 21 outpatient centers in Kenya, but in East Africa we have a total of 41 outpatient centers and 2 hospitals. My role is largely about overseeing the operations of the outpatient centers in Kenya, ensuring that we are giving the right quality of care to our patients consistently and with operational excellence. At the same time, basically building on the business relations we have with our partners. We embody several other SDGs. One is on gender equality, SDG 5. The other is on environmental sustainability through our Trees for Health program, Good Health and Well-being, which is really our core business, where we treat patients to make them healthy, but have a lot of health promotion programs that ensure that they stay healthy, thereby preventing illnesses that are preventable. We created a program that screens people for chronic illnesses, the non-communicable diseases like high blood pressure, diabetes, high cholesterol and cancers. And through that we've been able to have screen up to 6,000 patients this year. And we identify the patients with high risk for these conditions, put them on a treatment plan, and continue monitoring that they do not develop the diseases. What this has done is it has enforced the impact we wish to make in the society in East Africa and in Africa at large. And so we were able to come up with a project that is scalable, and every year we keep getting more patients screened. It has also enhanced our business partnerships where employers and insurance companies find value in our relationship because we are able to help them with risk management for their staff and also for those who are insured by them. To hear that more and more people are getting screened, for me personally it gives me a lot of satisfaction because I feel that this program is actually having impact, especially when we discover more and more people at early stages of either high blood pressure, diabetes or cancer. We've actually had quite a number of people discovered in early stages of cancer and they go for curative treatment, which is something rather alien to many Kenyans who think when you get diagnosed with cancer, for example, that's the end. What I can say is we've had over 20 cases where we've caught the cancer at early stages, particularly cervical cancer, which is one of the most prevalent cancers in women, and also prostate cancer, and we put the patients on a treatment plan. So I get really excited when I see the number going up because it means then we are reaching more people and we are touching more lives. Healthcare has been a bit quiet in terms of the impact towards SDGs, particularly in the countries where we are operating currently. And part of the issue has been around us articulating the impact of what we do on a regular day-to-day basis towards the SDG goals, or measuring, the number of lives that we are touching or the difference that we are making. So I think for me, this has been an opportunity to show other healthcare providers that they can actually plug into the SDGs and still meet their own goals as companies, or even if they're in the public health system. The other thing is that I was able to win the SDG Pioneer for Kenya and then go on to the global round and win. I think has encouraged many people to believe that even their projects can actually take them to such heights. So I feel that they would be more keen to, participate more towards the SDG goals in their various capacities. I was named SDG Pioneer for preventing non-communicable diseases in the workplace, which basically speaks to SDG 3, which is around good health and well-being. I think for me, I'm excited because it falls smack in the middle of what I do every day. So basically, it means what I'm doing every day is making a difference to the world. It also, for me, demonstrated that what we are doing in our space in AAR Healthcare can actually be scaled up either at government level or even internationally by other countries in Africa, despite their unique challenges, so that you do not have to have a high resource environment to make a difference. And I feel inspired to continue working towards achieving sustainable business practices in my capacity in management, but also as a medical doctor treating patients through our outpatient facilities every day. It's given me a good platform to advocate for more around good health and well-being. This was just one of the many lines that we need to speak to. But then there are issues around mental health, there are issues about maternal and child health that we also need to address. And this helps me basically put also the targets or bring down the targets to company level. And so I expect that there will be more energy towards achieving some of those targets in other health areas. And I expect that I'll be able to bring on board more of my colleagues so that in their various capacities, we are all, forging forward on the global goals.